All right, hello and welcome. This is Dr. Peter Solomon, chiropractor, and today I am going to discuss a condition called plantar fasciitis, which is an inflammation of the plantar fascia, the plantar tendon on the underside, the sole of the foot. So if you've had plantar fasciitis or you're suffering from it right now, it's quite a severe pain in the heel. Quite a stabbing pain. Typically first thing in the morning, first few steps are very painful, and kind of gets a little bit better with a few steps. Definitely a lot worse when you are barefoot or in flat shoes, and made a little bit better when you're wearing something with a little bit of a heel. So ultimately, I haven't really seen plantar fascia tendons tear, but definitely become very inflamed and create bone spurs. So bone spurring is probably one of the worst, side effect or downstream symptom, where the tendon is pulling on the bone so hard that over time the bone grows more to reinforce that attachment and grows a bone spur at the heel. So pain at the heel, pain and inflammation with walking, heel spur, possibly rupture, although I don't think that is that common. I'm just going to change the camera angle and just show you, using this little piece of yoga mat, what the plantar fascia looks like or where it's located. So if we take a look here, you can see this is essentially the plantar fascia. That is where it sits in the sole and the underside of the foot. And it's there, the plantar fascia is there to support us in standing only, not when we're in propulsion. So it's a thin tendon, it attaches on the heel right here, it attaches the heel to the forefoot. All right, so now you've seen the location, essentially the little plantar fascia, thin little tendon on the underside of the foot, again attaching the heel to the forefoot, and it's there to support that longitudinal arch when we're standing. So it's not designed to dynamically stabilize the foot in walking and running. There are other structures that do that, and I'm going to get into that right now and explain what those are. So the heel bone is called the calcaneus, and that is where all of this kind of whole plantar fasciitis revolves around, and that's pretty much where it comes from. The inability or inability to be able to invert and evert the heel. So when we're walking, and you take a step and your heel hits the ground, and then your foot follows through and hits the ground, to allow your foot to be a loose mechanism to be able to conform to the shape of the ground, your heel kicks out, which is called inversion, and your foot can kind of grab the ground, and it's nice and soft, it can conform to the ground. And then when it comes time to toe off and to create force to load your hip up and move through your gait cycle, the heel kicks underneath, it inverts, which then locks the foot, turns the foot into a rigid structure, which our calves can then propel the lower extremity and the ankle and push you forward. So the problem comes in where the calcaneus, the heel bone, stays everted and doesn't invert, and therefore we're propelling ourselves on a loose foot, which is an unstable mechanism. And then the only way our foot can find stability in that process is going to the plantar fascia and forcing the plantar fascia to work harder and to do a job essentially it's not designed to do, which then creates inflammation and tearing and all kinds of stuff. So to understand that and how the calf is involved in that, so the calf muscle, when you're going through your gait cycle, heel strike, then you land your foot, and then you're going to toe off. The calf at that point is stretched, and the calf needs a solid structure for us to push off of. And you're going to get dorsiflexion at the ankle at that point. If you have tight calf muscles, you're not going to be able to get that dorsiflexion because the calf isn't going to be able to stretch through that range of motion. So if the calf cannot give you that dorsiflexion, it's got to come from somewhere for you to continue your gait cycle. So your body will then keep your heel kicked out so that the midfoot is loose, to allow dorsiflexion on that bend to actually happen in your midfoot instead of at the ankle and through the calf. So tight calf muscles are definitely kind of at the root of this, and that's where we're going to focus our treatment. So we do talk about rolling the foot, icing the foot, In-office treatments, what I would do is ultrasound, some dry needling or acupuncture into the sole of the foot, maybe some electric stim, and then taping the foot to support that structure. But that essentially is just for the acute phase to get you through the acute phase. But once you are returning to, once you're subacute and you're out of the acute phase, the pain is coming down slightly, then what you want to do is you want to start doing some stretching and doing some home care to loosen the calf muscle in a very specific way to allow that calcaneal movement so you can get inversion and eversion and you can get proper foot function so it doesn't load the plantar fascia. So I'm going to go into a few exercises now using a few different aids. Essentially all you need is a wall to lean up against for the calf stretch, and for the rolling I typically use a little rubber ball, something like this, like a solid rubber ball, so not a tennis ball but a solid rubber ball, a lacrosse ball, a physio ball, something like that. If you don't have something like this, you can just get a small bottle of water, throw it in the freezer, get it nice and solid, and you can use that to roll the underside of your foot. So I'm going to just change the angle here a bit. We're going to go through some exercises. Yeah, so probably the most common exercises and home care exercises you've probably seen is this rolling the foot on the ball. So just using that ball, so you can either, I'm sitting right now, but you can stand up and do that and just obviously monitor the amount of pressure you're putting through that. But yeah, you are rolling the underside, the plantar fascia, to essentially stretch it out and alleviate some of the tension that's in that muscle. So the other little bit of home care I would suggest to do is with that same ball that you're using, is find that little ridge coming off your shin from the front to the back of your shin. There's the little ridge of bone before it turns into muscle. You're going to take that ball and just roll off that edge and kind of come up behind the tibia, behind the bone in the front, and you're going to roll along that ridge. You're going to put some fairly significant pressure into that, straight down, and then also slightly forward in that direction against the back of that bone, and spend a couple minutes doing that. So with the rolling on the ground and with this rolling, I would essentially spend 2 minutes doing each of those. So the calf stretch I was talking about is this one here. So we are stretching this leg here, so I'm stretching the back leg, standing up against the wall in a normal typical calf stretch, and keeping the front leg bent and the back leg straight, and just driving your hips towards the wall and your knee slightly, your back knee, the left knee slightly to the ground. So this is the side I'm stretching, this is the problem side, I'm going to say it's the left side. So this is just a normal calf stretch, and I would say you're going to do this for a minute or two. But the difference with this calf stretch is that you're going to take your front leg, your leading leg, the one by the wall, and you're going to put it across your body. And the reason you're doing that is you're trying to change the angle of the calcaneus so that you are then putting it into an inverted position so that you're able to better facilitate the inversion of the calf, or of the calcaneus, with proper calf movement and proper calf flexibility. So you can either just keep it here this way, static the whole time you're doing the stretch. What I like to do is take my foot back and forth while I'm into that stretch, and then maybe each time I dip into that stretch I go a little bit deeper, but moving my foot back and forth to keep that calcaneus mobilized. Alright, so yeah, hope that helps with a bit of info about plantar fasciitis. If you're a runner or any other kind of athlete and you have pain on waking, first few steps in the morning, pretty severe pain in the heel, then I would suggest you get it checked out. Take a look at some of these home care exercises and give them a try. Icing the foot down, addressing the initial inflammation is essential, and I would then start, once that inflammation is calming down a little bit, or you've had a couple days of just icing it and resting it, maybe taping it, bracing it, and wearing some appropriate shoes, then I would progress onto this home care program. Yeah, and that should help. It's the calf stretch is definitely the kind of the silver bullet in all of this. The rolling, if you just do the rolling and the icing and you don't address the calf, the plantar fasciitis will 100% come back and visit you again in the future. So address those calf muscles. There is one thing, if you realize that your calves are not tight, which is quite rare if you're an athlete, but if they are not, then it is more than likely the opposite side, glute medius, that is causing issues, dropping your hip, causing extra pronation in the gait cycle. So that is another issue. That's another video. We can get into that at another time. Any comments, please leave below. I would appreciate a like, and yeah, see you next time. Cheers.